Okay, Al, thank you. And this morning on Today's Health, your embarrassing questions answered. So if you're a little shy about bringing certain issues up with your doctor, we are here to put you at ease. Dr. Keri Peterson is an internist and contributor to Women's Health magazine. And most importantly for this segment, you have seen it all. You've heard it all.
I have.
All right.
Everything we're talking about.
Let's get to our first question. This isn't so embarrassing. A lot of people deal with this, but we have someone writing, I get very nervous speaking in front of others. My voice quivers, my heart races, and my face turns red. Is there anything I can do to prevent this from happening?
Public speaking. This is reported as the #1 fear among American adults. And it doesn't just happen to people who are shy or timid. It happens to people who are outgoing and confident. And if you have a meeting or if you have to give a speech and you're nervous, you are not going to be able to deliver your message. So we have a couple of tips for you. First, deep breathing is the most effective thing that you can do, both before, which calms you down, and during, because when you're anxious, your vocal cords tend to clench up, and when you deep breathe, it opens your vocal cords and you can speak more fluidly. The next thing to do is avoid anything that's going to worsen your anxiety. So that would include caffeine. Caffeine just exacerbates your rapid heart rate and your hand shaking, so stay away from that if you're prone to having a fear. Next thing is practice. Practice, practice. In front of a mirror, in front of your family, become more comfortable with your material so that you can deliver it, again, more comfortably. And then another little trick that some performers use is called a beta blocker. This is a blood pressure pill, but it has an interesting side effect of blocking the effects of adrenaline. So even if your mind is telling you, I'm nervous, your body doesn't respond. Your hands don't sweat, your voice won't tremble. So it just gives the appearance that you're calm. And then lastly, if you really have severe anxiety and social phobias, I would consider therapy.
Yeah, okay.
Yes.
What about picturing the audience naked? Not medically desirable?
I think that that would work.
Okay, I mean, that's the old technique. Okay, next topic, staying regular on the road. The question we got is, every time I travel, I get constipated. Why does this happen and how can I avoid it?
Traveling is a very common cause of constipation. There's several contributing factors. One is when you travel by airplane, it dehydrates you and you drink less water. But then once you get to where you are, so many of your daily routines usually change. You're eating out at restaurants more rather than preparing your food. You may be jet lagged and having an altered sleep routine. You're not as active and you may even be under stress, and all these things contribute to bowel function. So at Women's Health, we recommend doing 4 things. The first is incorporate fiber into your diet before you go and while you're away, and that can either be in the form of fruits or vegetables or even a fiber supplement. The next is to drink lots and lots of water, especially if you're taking an airplane and then once you get where you're going as well. Next thing is exercise. If you move your body, your bowels will also move in response to that. And then finally, as a last resort, just pack in your bag a laxative just in case.
Okay, but hopefully one you have experience with, so nothing
yes, no
kooky
surprises.
happens. Yes, okay. Another embarrassing issue, a lot of people talk about bladder problems, and the question we got was, I've had 3 children and tend to leak when I laugh, sneeze, or pick up a grocery bag. Is there a way to treat this?
This is called stress incontinence, and women who give birth have this as a common result. And the reason that it happens is that the pelvic floor muscles dilate and weaken when you give birth, and it causes the urethra's angle to change as it enters the bladder, and you can't hold your urine in as well. Now, this also happens in advancing age, can happen to women as they go through menopause, and if you're overweight, you may also have a predisposition. And as this person mentioned, when you bear down on those muscles by laughing or by sneezing, you can leak urine.
So how do you prevent it?
So the most important thing you can do is called a Kegel exercise. What this is clenching the pelvic floor muscles. These are the muscles that hold in your urine. Ideally, you want to hold it in for 3 seconds, relax for 3 seconds, do 10 of these 3 times a day, and if you can build up to 10 seconds at a time, you can lower the likelihood of leakage by 60%, which is very significant.
Add that to the exercise routine right after the push-ups. Okay, next question. My hands start to swell when I walk for a while. Is that normal? I've never heard of that.
It is common for some people, and for the people that it happens to, it's very frustrating because your rings can get stuck and your watch feels very uncomfortable. So 2 things are thought to cause this problem. The first is when you start exercising, your blood rushes into the muscles that are working, and as a result, there's less blood in your hands, so your vessels dilate to compensate. But then as you warm up and your body starts to get hot, now the blood starts to be sent to your hands and feet to dissipate that heat. And if the vessels are already dilated, they're going to swell.
Okay. And last question we have, can I pick up germs from sitting on a public toilet? This is a question that America needs answered,
listen
doctor.
up, America. So basically, Toilet seats are very, very dirty. There's no doubt about it. They're
Go
covered
figure.
in bacteria from fecal matter. However, you are very unlikely to get sick from them because our skin is a very effective barrier against germs. That being said, if the toilet is filthy, use a different one or put down toilet paper. And if you have an open wound on the skin of your buttocks, be very cautious as well. And the most important thing, your hands are what are the concern, because if they touch these surfaces and then you touch your face, you're going to get sick. So wash your hands.
Wash those hands for 30 seconds. Scrub.
Scrubs. Happy birthday twice.
Sing a little song, or the ABCs. That's what we tell my nieces.
Good idea.
All right, Dr. Keri, or the national anthem.
Whatever you want.
Be patriotic. Okay, Dr. Keri Peterson, thank you so much. See you next time.
Thanks a lot.